Tennessee.
Thank you. Yes, and I'm just going to give again, happy to have you all today. Just quick introduction overview of the Dental Informatics Working Group, and then I'm going to introduce our speakers and we'll move forward. So we just did this. Our vice chair is Senya Busari, who was unable to make it today, but we still honor her today. So welcome. Quick overview, our mission as this informatics working group is to serve as the focus for individuals and organizations with interest or involvement in health informatics with an emphasis on dental informatics. So we have several different professional students involved in our particular working group that we're working together to push the agenda for dental informatics along. You can see we've had a little bit of growth along the years, and so just looking to move forward in that. Most of our membership are in the academic institutions, 62%, but we have a pretty good research institution also in industry. And then also just like 60% are in academic, 46% are professors. Okay. I'm on, man. Got that quick. Let me see. All right, bro. Hey, have fun. Okay. And we just an introduction of our speaker today, Ms. Rose Nobley. She will tell you about her experience. She comes from the Southeast Alaska Regional Health Consortium, also called SEARCH, and Teeth Cloud, and she'll give us more information about that. I'm so happy to have met you, and I look forward to hearing your talk this morning. Thank you.
Hi, good morning. Thank you for having me. I'm going to put up can I share my screen?
Sorry, yes, you should be able to.
Okay. There we go. Thank you. So I am a dental clinical informaticist, and I am based in Juneau, Alaska. That's why I have that beautiful Northern Lights picture back there. And yes, we do get to see that from time to time from my location. I work for SEARCH, which stands for Southeast Alaska Regional Health Consortium. And we are a public health entity for Alaska Natives and American Indians. And then we provide medical and dental care. In 2017, we partnered with another group to share our electronic medical record. And that is with ANTHC, which stands for Alaska Native Tribal Health Consortium, based out of Anchorage. And that was a really big win for our patients, because Alaska is still known as the last frontier, and a large portion of our population does not have access to care, particularly to specialists. And we find ourselves traveling quite a bit, either to Anchorage or down to Washington State. So now when we do these travelings, right, we can, our providers can have direct access to the records that we got from our hometown. We still, though, maintain our own electronic dental records. And I support 16 dental clinics, and most of them are part of the Alexander Archipelago. You can see on the map there where we are located in Southeast. It's all islands, and none of our clinics have direct road access, including Juneau, where I'm based out of, which is interesting because we're the capital for the state, and you're either flying or boating in and out. And this is where this problem comes, of course, for for access. 5 of our clinics are fully staffed, meaning we have hygiene, assisting, front desk, and dentists. 2 are partially staffed with either we have dental health aid therapists or a dentist, and the remaining are only supported by traveling staff. So we operate, our providers travel quite a bit. So it's really important that they have access from all locations of our patients' records. And also when we send our patient, we don't have pano machines, right, or 3D capabilities in all of our locations because of our network and our bandwidth. So we'll send different patients up to the closest main fully staffed clinic to get images, and when we come, but they'll be getting their care in their hometowns. So again, it's important that those doctors can retrieve and access those records. So part of my daily routine within all of these clinics is to gather and analyze data to help design better workflows. And along with that, I measure the impact on patient care and the end user satisfaction. So I need to consider that the changes improve the workflow in one area, but add to a workflow in a different area, because of course that person is not going to be very happy. And I manage all of our different systems and components that we use. So besides our electronic dental records, right, there are multiple applications such as our imaging, which includes our 2D, 3D, intraoral. We utilize CAD/CAM technology for a lot of our restorative treatments. And we also do e-prescribing. And along with all of those systems, of course, come education and training for all of our end users. And of course, our clinicians are really busy, right, treating patients. Our IT is really busy, keeping the networks running and our servers running. So I kind of serve as that liaison between the two. So some of our applications, as I was mentioning, we use Dexis for our 2D and Vivo for our 3D. And we do all of our prescribing through our EMR. And currently, our providers have to sign into a separate application for our prescribing. So one of the projects that we're working on is seeing if we can have a direct plugin or API interface within Dexis, so that we can just, it'll be much easier. They can just click on it and access those records. Or if we can use HL7 to have those medical records go directly into Dexis. PrimeScan is another program that we use for our CAD/CAM. And we just launched MouthWatch for our intraoral imaging. And then of course we have patient communications for text messaging, for online scheduling. And then we use another application for digital intake forms. And not all of these speak to each other. So I have to come up with different workflows until, to make things quicker. We want to reduce our clicks. That's what we hear from our providers, right? Having to go in and out of different multiple systems. And with so many different components, of course, and such a big consortium, things go awry at any given moment, and quite often. So a big part, of course, that comes along with those systems is training. And within Southeast Alaska, of course, we're remote, so we have a really high turnover. We have contracts. That's how we get people to come out here. We're located in the Tongass Forest. It's a lot of rain, a lot of snow, and of course, not being able to leave and travel is really difficult for people. They don't find this part of the region to be their forever home. So we have a lot of locum providers, and we also have a residency program, and we get people to stay, for 2 or 3 years at a time. And because of that, there's constant ongoing training. We're constantly onboarding and getting people, brand new people in our systems. So I do job aids, and we have a SharePoint site that everyone can go to. I also do training videos. We have a software program that IT uses. And then we also do in-person training. A lot of times I like the in-person is best, and then people can refer to either the written job aid or the training videos for reference to go back to. And that keeps me quite busy. And then we have our help desk for support. And within that help desk, I am an agent, and we have, this is how I know of everything that's going on between all of our 16 dental clinics. People can report incidents, which would be such as, I lost my image. They just took a picture, it's disappeared, it's not in the patient chart. And so I'll remote in and I'll try and find those images, or sometimes it requires a support call to our actual company to help us on the back end. And then we also have service requests. Those would be things such as a provider's wanting to add different codes to their templates, or if they want to have a new job aid or a video for a particular workflow. And then we also have change requests, such as we want to get a whole new entire imaging software, which is where we're currently at right now. And that's a big project for us. And then we also have project scoping, where this also kind of falls along with our imaging, right? So if we are looking for a new vendor to support us in our environment, we would scope out first what kind of what companies, I guess, could accommodate our type of setup. One of the things that's on our project list right now is looking at a new electronic dental record that is more customizable. And so those take like 1 up to 2 years sometimes, because they have to get vetted through each department. And it keeps me quite busy. One of the things that our imaging we're working on actually came through an incident report. We had a doctor who took a 3D image. They couldn't access the chart at the moment, so they just put it in a test patient, and we needed to transfer it over. And when I went into the clinic, because sometimes I just can't do things remote, I need to go in there in person, so I travel a lot as well between our different clinics. And I realized that this particular setup at this clinic, nobody was able to access our 3D images outside of the actual Pano acquiring station. So anytime a doctor wanted to look at this case, they had to go into the Pano room, which of course is busy. This is our big clinic that had 20 chairs. And I didn't realize that, and neither did anybody else. We haven't had anybody in my position prior to me. So as each of these clinics were added on, they each kind of developed their own workflows, for whatever reason. And also, when this clinic was set up, our networking capabilities were quite different. So we only had it set up to capture and view in this one station. Well, we've improved our network. And so now we are able to not only save at the local, but we can send out our images across the WAN, our wide area network. So it brought a whole new change request, because we also realized that even though we can see our 2D images from any of our locations, our providers weren't able to see the 3D images on all of our locations. Because of the file type and how big it is, they weren't successfully able to be transferred across the WAN. So we're currently in the testing, because we have a new network of being able to do that. And so far it's working, but we're now also looking at going to a VNA for our hospital and our medical or vendor neutral archive, so that in the future, if we have to do any type of moving from one system to another, or if a provider is ever outside of our network, they can easily just log in and have access to those images. Because we do have providers that come up every 2 or 3 months from Washington or from Northern Alaska, some of our oral surgeons and ortho, and they go back home and they'll consult with other physicians, and they want to be able to have access to those images. So creating a workflow of how to export, deposit, where we're going to deposit those images so that they can be shared. And of course, a HIPAA compliant atmosphere is one of the things that I currently work on. So there's a lot of different things going on at multiple times, and some days can just be so busy, it's hard to keep track of everything. And then we have our long-term projects that, that we're also constantly working on. So I love it. It's very exciting and demanding, and it's new. And I wish that there were more people out there like me so that I could, converse with and brainstorm with and see what they're doing and how they're getting, how their workflows, work for them. So when people ask, what does a dental clinical informaticist do? My answer is everything. It's a very rewarding job and exciting, and I love it. And I'm sure I'm learning again as I go along. There isn't really anybody to kind of say this is how we do things. So it's a lot of figuring out for myself, and a lot of communication between our two teams and trying to come up with systems that work for us. So that's what I do. Thank you.
Thank you, Rose. This is Khader, everyone. Apologies, just got a timing mismatch at my end as well. Hope I'm audible. Hello.
Yes.
Yes, Khader, we can hear you.
Yeah, thank you for that. So yeah, that was an interesting walkthrough, Rose, about your day as a dental clinical informatician, and thank you for sharing those insights. So I would just like to open the floor for questions. And if you have any questions, please feel free to post them in the chat as well so that we can have Rose answer them for you. So while we have questions in the chat, I just have one quick generic question, Rose, for you. So I just wanted to know your thoughts on how, as the budding dental informatics students, like we who have a dentistry as a background and also who are pursuing our health informatics as a careers. So what is your 2 cents on bridging that gap of, becoming that transition from oral health to informatics?
Transitioning from clinical to informatics?
Correct. The dental perspective.
I would say is to be very familiar with computer technology. I know that there is so much more that we can do behind the scenes with programming, with HL7 and with SQL. That is not my area of expertise, but it's really needed because, again, nobody wants to be logging in and out of different multiple applications, and having having people that can do that programming side and advocate for interoperability is really important. We're very fortunate right now that our 3D imaging does have direct integration with our our electronic dental records, so we can access everything all from within the patient chart. But our medical history and our medications, we cannot. And so that poses a big problem for us because we have to go outside of our system to access that. Also, any type of, again, network background that you can familiarize yourself with is very important. Our particular consortium utilizes Citrix. It's an information retrieval service, where users can access programs and file and a variety of services through a central application or web browser. So when we're looking at adding things, we want to see if they can be virtualized, such as like our intraoral camera. Most of these things were designed for just a small 4-wall office, right? And so we want to be able to add applications where if a provider travels to one of our remote sites and they go to plug in an intraoral camera, right? And it's like they don't have the program on there and nobody's physically there. We want to be able to push it out, over the WAN and have them just plug and play and not have to worry about having a tech there to install anything. So just knowing how these systems work and being knowledgeable on that IT side, I think would be very, very helpful.
That really helps. Thank you so much, Rose. Is there any other questions from our audience in the chat?
Thank you, Rosa. This is Sajish here, and yeah, as you mentioned, you used the word. What was that? Dental clinical informatist. I wish there is trainings and training opportunity for our dentist or College of Dentistry students or dental hygienists for that matter, and a kind of certification program. And in our DI, our Dental Informatics Working Group, we have a subcommittee looking into this, the curriculum aspects of dental informatics. I would, I invite the participants here, both the presenter and all others, to communicate with our leaders here, and the email will be given. So let's talk about having some kind of a training, very specific for dentistry. AMIA has certificate programs and other programs in clinical informatics. So even there is an annual conference on clinical informatics. So slowly but steadily, let's work on something on that line to have very specific for dentistry. So any suggestions or anything is or ideas are welcome.
Yeah, sorry, please go ahead.
No, I was reading in the chat. It says, yep, there are multiple modalities of different images, electron, and even text. Which do you think as researchers should focus on and which modality should be targeted? I would say imaging, because unlike, medical doctors, you can go into many appointments and you'll never have an image taken, but dentistry, we operate on imaging for most everything, right? Especially, we're becoming very high tech, right? We're now our doctors are using 3D for root canals, ortho, and implants, and not being able to access those images from any of these locations is a huge barrier for our clinicians and for our patients. So one of the things as we're vetting different vendors, right, is nobody is really set up to work across a WAN. So we're trying to find vendors that are willing to work with us in our setup. So it's very unique. And that would be where I would focus on the most, because that seems to be one of our biggest challenges.
Thank you for that. Do we have any? Thank you, Sonish, for that question. Just leave the floor for a couple of more minutes if we have any questions.
I just wonder how the participants feel, especially from a clinical standpoint, the interoperability issues and archiving the images. So what's your experience or your future plans in your clinics, if there is any? Can I call out name? I'm just good in that. Brian, do you have any take on that?
Sure. So currently we use at Iowa, we just have MyPacs, but we have a single location. So we don't have necessarily the issue of sharing it between multiple locations like you do. But we have had issues with, saving it in the wrong account or people having issues opening up cone beam CTs. Right now, I think we're upgrading our to the newest version of MyPacs, but we're so that we can upgrade our EHR Axiom. But we have found that one of our cone beam machines, I can't remember the brand it was, we under the new MyPacs, we can't load the images. They won't show up. And that's evidently now, communicating with the company, that's a known issue. And so they're trying to solve it for us, but we can't move forward with anything until they resolve that so that we can actually read those cone beam images. So that's something that we've been working through, but as an example, but yeah.
Yes, Brian. Yeah, we are at the University of Tennessee. We also use Axiom. Let me bring. I can see one of my colleague, Colette. Colette, are you here? Hello. Okay, let me call Lois Allen.
I'm sorry, I was having a problem getting unmuted. Yes, I am here. And yes, we do use Axiom.
Yeah. Can you tell your experience with that?
It's not very user friendly. First off.
We have been using it for some years, and we have been looking for some kind of replacement or add-ons to it. Let's see how it works.
Yes, I think if we could get all the licensing that the program actually offers, it may be better. But as it stands right now, there's a lot of flipping back and forth between screens, and there's no way to export data into Excel. You still have to build your own Excel worksheets and import your own data.
Yeah. We use several other digital parameters there, and interoperability, different manufacturers and all things. So it's a big issue here. And we have several locations apart from our College of Dentistry. We have spread throughout the state of Tennessee in our rural areas and all things. So there is a big push for more interoperable and communication facilities and everything. So including teledentistry. So we are looking to upgrade this system at the moment, our IT system. Thank you. Anybody want to add on to their experience, Simran?
I agree with whatever Colette said.
Yeah.
Yes, we
using
work
Axiom
together.
or?
So we use MyPacs and Axiom, and just like she said, it is harder to teach students how to use it too if you yourself cannot accomplish things that you need to.
Good. Glad to hear some conversation. And
does anybody here use Open Dental?
No.
No. But there are several apps and tools nowadays coming, and our students are not trying different tools, especially in our remote locations.
Yes, we were looking at MyPacs, but we're not quite settled on that being the solution because they don't have an automatic store and forward for us. We would have to save and push that out manually every time, which isn't a good workflow once our providers found that out. Yeah. And, there's another vendor out there, Infinite, which is very promising, but they don't have a relationship with our current EDR. So it would require a separate login. So then that leads us to look at a no ADR, which we were currently looking at open dental. So it's like one thing, leads to another. And again, it all comes back to that interoperability.
Yeah. Especially during this COVID pandemic, last 2 years, there has been several players in the market with connectivities and interoperability things. So our IT system, our IT office is looking into upgrading the ones we have right now. Thank you.
Hi, Rose. Thank you so much for sharing your experiences. My name is Winnie. I'm a clinical dentist. I work in Los Angeles for an FQHC. So I'd like to think I'm out in the quote unquote real world. We don't have the same, I guess, issues as some of the dental schools are having. We do have some dental students rotate through our clinics for a week or two to get some hands-on experience, but just to share a little bit about my experience with EHR, we are currently using Epic, and so their dental application is Wisdom. So the advantage of that, I think, is just the fact that we do have access to their medical records and at my fingertips. So if I need to know any of their medications, their allergies, their last visit with their PCP, that's all there for me. I have yet to discover an EHR system that has native X-ray capabilities because, most of these EHR systems were built around the medical field. And dentists like having options. We currently use XV Capture for our X-rays. So it's not within Epic, but they do work with it. So it's fairly, yes, there's another click, but the fact that I can still take an intraoral picture, whether it's, on my phone, on the patient's phone, or with my intraoral camera, and that can directly upload into the images. It seems the most convenient, I guess, of having all that data in one place. One of the things I think is an advantage for my specific company is Ultimate has, they do appreciate and value a clinical informatics team. So I have also had a difficult time finding a dental informaticist in our world. I am the only one for our organization, but I am surrounded with at least today anyway, 3 physician informaticists, and they have their own specialties. We have a pediatrician, we have a family practice person, and they all have different specialties within Epic. So I can always, excuse me, if I have questions, go to them. But in terms of organizations or companies, or the dental student who had that question about how he can leverage his dental background into a career in informatics, it is very new, even for the physicians. So all I can say is, the more visibility we give ourselves and put ourselves out there through different organizations and speak about what it is that we do, we know the value that we add to any organization, because somebody has to make sense of all of this data and all of this technology tailored to what we do as dentists. So in terms of, again, I wish I could give you options or recommendations for a one-stop shop. I don't believe it exists quite yet, but we certainly have the knowledge and possibility out there. We just need to, again, find the right team of people to make this happen, because that's where we're headed. So it's just a matter of getting that information and that interoperability between all the technical aspects of what we do as clinicians into user-friendly EHR system so that it is pretty self-explanatory to where you can click on what you need and it's all right there at our fingertips. So I have to believe that it's within our reach, within our lifetime anyway.
Hopefully.
Yes.
Just one more thing, Louis, Alan, you have anything from VA perspective to add on? Before we end, we have more than 5 minutes.
Yes, at VA, we have dental record management. That's what we use here. So it works with Vista. And so we're getting ready to go to Cerner. So I'm not sure how is it going to work with Cerner.
Oh, okay. Thank you.
Yep.
Kader, you want to take over? Thank you for the great discussion. But everything boils down to the thing like we need some kind of decision makers within dentistry, like dental clinical informatics, like Ross mentioned. Some kind of training is needed. It's very specific for dentistry because our needs are different compared to other medical ones. So our specialty is different. So please join our monthly meeting. I invite all the participants. We can think about some curriculum designing on that aspect, through AMIA, through the different universities, we can discuss it. Thank you. Kader?
Yep, thank you so much, Sajesh. Thank you, participants, for that wonderful discussion, and that really opened up an insights for much more to think forward. So I move forward on this presentation. So I would request Dr. Sajesh to just go ahead and appreciate and present the certificate of appreciation to our speaker. Yeah. Over to you, Sajesh.
Thank you, Rose Nobly, for this webinar today. I personally liked it very much, and I think it's an excellent, very crisp and clear information you gave, especially on clinical aspects of clinical-oriented aspects of dental informatics. On behalf of AMIA Dental Informatics Working Group, as well as my leadership committee here, and also all the participants and AMIA, our organization here. A big thank you, Ross, for coming forward and giving this presentation today. This is our first presentation for this year. Thank you for being here.
You're welcome. Thank you for having me.
Thank you.
Thank you, Sajesh. Thank you, Rose. So I'll move forward and share you with the snippets of what we are going forward with our way forward for the goals of 2022. So working on the scholarly output, we have the dental informatics curriculum that is coming in a place where we have a workshop, certificate programs, and journal informatic programs is our goal. And we're also planning to come up with an abstract submissions where there is a due that has been mentioned there. If everyone's interested, please go ahead and reach out to our representatives, and you can directly reach out to me. I have my email ID shared, and you can put it in the chat as well so that we can reach out to you if any case. And also we have our membership meetings, that is on the monthly membership meetings that has already been mentioned by Sajesh. So that's on the first Wednesday. Feel free to join those meetings and share your insights. It will be a welcoming session, and it will be glad that you participate in it. And next is the outreach programs that we have a quarterly webinars. That's like this kind of webinars where anyone from the school, students, private practitioners, organizations, we welcome anyone to come in and participate, to share their insights on both the worlds, the best of the both worlds of dentistry and informatics. And our outreach has been very well till now, and we want to expand it and explore the much more aspects of how private dentistries and government and dental organizations come forward and create a standardized and structured way of having people participating in these organizations, as the speakers have already mentioned, where we really look forward to have an engaging and a coordinated and collaborative efforts to make dental informatics into a mainstream informatics, because the dental informatics needs are different from the real informatics. So I just move forward and thank you all for attending today's session. And if there are any discussions and questions, I would still, in given interest of time, I would still open the floor for the discussions and questions on this. However, just like to add that thank you for attending this webinar today. And yeah, apologies for the timing glitch so that we don't have much participants who missed the session today, but we would have this recorded. So you would have this recording and everything sent to your email IDs based on the chats information provided on the chats. And also you can reach out to me. Here is my email ID. And the next webinar that is coming your way is on April 26th at 12 p.m. EST. So look forward to that. And there are much more interesting sessions coming up that it will be keeping posted. And moving forward, and finally, the participants all over on this session would have a certificate of attendance. So that's the kind of an appreciation and the kind of a participation that you would be getting. So look out for that certificate in your email addresses within a week's time. And yeah, thank you so much, one and all, for joining this session today and spending your valuable time for our quest of learning, a continuous learning.
Thank you all.
Thank you all.
Good. Want to stay back for any discussion or anything?
I just noted all the information and took few screenshots, sir. So I'll pile it up and
Excellent.
make
Yeah.
it like.
Thank you, Priya. Thank you, Kader and Carmen, on timely intervention. It all went very well, smooth. We had a very good session. And you can save the chat. I can also try to save the chat, all the email address.
Yeah, the host would get the chat information anyway.
Okay, okay, good. Yeah, so we can you take down that email details and post it?
Yeah,
to...
everything I have noted, sir.
Okay, I think Sanya has a place where we can have the emails and everything for people. Good number, it's good. Yeah. I think there was a confusion on the time, right? Starting time. I'm sorry about it. Next time we can mention both the ET and the CST time, so there is no confusion on that.
Yeah, that was my apologies. What happened was I put it in Zoom, and Zoom was defaulted to Central Time, and I did not notice that until this morning. So my apologies for that.
Thank you. But it was good. Kader sent that PowerPoint in the morning, and everything was organized. Thank you, Carmen, for that introduction. So it all went very well.
Yeah.
Good.
Thank you, Carmen, for the timely guidance and support from your end, so that it helped. It really helped.
Priya,
that was wonderful. You guys did great work. Sorry.
Good. Yeah, sorry to interrupt. We'll work on the next webinar. That's April 26th. So a flyer need to be created.
Yeah. Within like 2 days, I'll send the basic information and we'll start with the flyer.
Yeah. Good. Thank you.
Anything else to be discussed?
That's it.
And,
okay.
That's it from my end. I hope we have the required information that has been shared, and not sure we have that. Someone is joining at this time. Maybe if the Zoom link is open at 1 o'clock, then people would join now. Maybe we need to send out an email stating that.
We can correct. Harold. Hello, Harold. Hello, somebody just joined. Can you hear me? That's okay.
Yeah, I believe that I probably we need to send a mail notifying this yeah, this confusion.
So Carmen, you have the recording links, right? You can stop it now. Stop recording. Yeah.